Lung cancer remains one of the deadliest diseases in the United States, accounting for approximately 25% of all cancer-related deaths. Every year, it takes the lives of over 127,000 Americans, more than breast, prostate, and colon cancers combined. Smoking is the leading cause, responsible for nearly 80% of cases, but other factors like air pollution, secondhand smoke, and occupational hazards also play a significant role. Despite medical advancements reducing cancer mortality by 33% since 1991, lung cancer continues to devastate families across the nation. Understanding its causes is the first step toward prevention. Oh, but smoking isn't the only culprit. Join us as we uncover the top 5 causes of lung cancer and how to protect yourself. Number 1. Smoking tobacco. Undoubtedly, smoking is the leading cause of lung cancer, responsible for nearly 85% of cases. Tobacco smoke contains over 7,000 chemicals, including carcinogens such as benzopyrene and formaldehyde. These substances damage lung tissue, leading to DNA mutations and tumor formation. The risk increases with the duration and intensity of smoking. Even occasional smoking can significantly heighten the likelihood of developing lung cancer. The good news is that quitting smoking drastically reduces this risk over time. Given its overwhelming contribution to lung cancer cases and its preventability, smoking ranks as the number 1 cause. Number 2. Secondhand smoke. Secondhand smoke, or passive smoking, is another major contributor to lung cancer, especially among non-smokers. Exposure to smoke from burning tobacco products contains the same harmful chemicals that affect smokers. Studies show that individuals exposed to secondhand smoke at home or in public spaces have a 20 to 30% higher risk of developing lung cancer. Children and non-smoking adults living with smokers are particularly vulnerable. Since secondhand smoke is difficult to control in shared environments and has severe health implications, it ranks second on this list. Number 3. Air pollution. Long-term exposure to polluted air is an increasing concern in lung cancer development. Fine particulate matter, PM2.5, nitrogen dioxide, and other airborne toxins can penetrate deep into the lungs, triggering inflammation and genetic mutations. Urban areas with heavy traffic, industrial emissions, and household pollutants from biomass fuels contribute significantly to lung cancer risk. Although air pollution is not as potent as tobacco smoke, its widespread and involuntary exposure make it a critical factor, ranking it third. Number 4. Occupational carcinogens. Certain industries expose workers to hazardous substances that increase lung cancer risk. Asbestos, arsenic, chromium, nickel, and radon are among the most dangerous occupational carcinogens. Miners, construction workers, and factory employees face prolonged exposure to these toxins, leading to increased lung cancer rates. While workplace safety regulations have improved, historical exposure still affects many individuals today. Due to its relatively lower prevalence but significant impact on specific populations, occupational exposure ranks fourth. Number 5. Genetic susceptibility. Although lung cancer is primarily influenced by environmental factors, genetics also play a role. Individuals with a family history of lung cancer have a higher likelihood of developing the disease, even without smoking or pollution exposure. Genetic mutations such as EGFR and ALK rearrangements contribute to lung cancer susceptibility. However, hereditary cases account for a small percentage of total lung cancer diagnoses, making genetics the lowest-ranked cause on this list. Despite this, genetic research is crucial for understanding risk factors and developing targeted treatments. Lung cancer is largely preventable, with smoking being the most significant risk factor. While air pollution, occupational exposure, and genetics also contribute, addressing tobacco use remains the most effective way to reduce lung cancer rates. Raising awareness and implementing preventive measures can save countless lives. By educating ourselves and others about the risks and warning signs of lung cancer, we can take proactive steps to protect our health and that of our loved ones. Knowledge is power. Let's work together to create a future where lung cancer is no longer a leading cause of death. Stay informed, stay vigilant, and prioritize your well-being for a healthier tomorrow. Please like, subscribe, and hit the notification bell to stay updated with our latest content. Your support inspires us to continue creating and sharing high-quality videos. Thank you for being a part of our growing community.